Now, with viral hepatitis, we have different types of clinical presentation with the so-called pre-icteric phase, and then there's an icteric phase. You see how initially they'll be asymptomatic. With the pre-icteric phase, we're saying before their jaundice, they have these non-specific signs and symptoms like malaise and weakness, nausea, and vomiting. However, in the icteric phase, they will become jaundice, and this is when their urine will be dark, again, because of the elevation of serum conjugated bilirubin. Again, it is water soluble. Don't forget that. Okay. Now, because with viral hepatitis, you're destroying the hepatocytes, your transaminases will be elevated. So ALT and AST will be markedly elevated on the exam. And of course, diagnosis is made by serology. So viral hepatitis can be acute and chronic. So with acute viral hepatitis, these signs and symptoms will be for less than 6 months. It can be caused by any of the different types of hepatitis, A through E. Microscopically, the classical thing is so-called lobular disarray. What does that mean? You lose that normal hexagon appearance of the central vein in the center and the portal tracts in the periphery. So you lose that parenchymal architecture. They also get the balloon cells, hydropic change because of reversible cell injury. Councilman bodies, which represent apoptosis, small, round, eosinophilic lesions that are extracellular. Okay, you're going to have infiltration of lymphocytes inside the parenchyma as well. Hepatocytes can regenerate, so you'll see some of that, as well as cholestasis. However, with your chronic viral hepatitis, now we're talking about signs and symptoms for greater than 6 months, typically caused by hepatitis B, C, and D. Okay, so here they can separate your chronic hepatitis into persistent, or mild sometimes it's called, versus active or severe. When it's mild or persistent, all you're going to see are chronic inflammatory cells around the portal tract, so-called portal triaditis, okay? As opposed to chronic active or severe hepatitis, the inflammation will leave the portal tracts, go out to the parenchyma, giving the so-called piecemeal necrosis. Piecemeal means patchy, okay? The necrosis also can bridge the portal tracts, so terms you also see will be bridging fibrosis and bridging necrosis, so be aware of that for the chronic active or severe hepatitis, okay? Also, too, you can have the so-called ground glass appearance of the hepatocytes, microscopically, typically seen with hepatitis B, secondary to your carrier state. When we look at the different types of the hepatitis viruses, so our main ones are hepatitis A, B, C, D, and E. So very important we talk about how they're transmitted. Okay, mode of transmission is important. The serological tests, of course, are important, and any complications that you might get. So, of course, hepatitis A, that's the one that's active, short-lived, associated with a fecal-oral transmission. Again, that's the one you eat a bad salad, and they're going to be sick for a while, and then the symptomatology goes away. As opposed to hepatitis B, remember that one. They like that one. Number one, it's the only one that's DNA. Remember, all the other ones are RNA, so hepatitis B is DNA. Be aware of that. It can be transmitted by all body fluids. However, typically in exams, it's going to be IV drug abuser, or the transmission will be secondary to sexual contact, typically. It can become severe, so it's very important to remember. As opposed to your hepatitis C, mainly is transmitted by transfusions, okay? There have been some cases of sexual transmission, but mainly secondary to transfusion, okay? Typically, if there's severity, it's going to be subclinical. The key with hepatitis D, you must have B along with D, and typically you have either the co-infection or superinfection. That B plus D is worse than just B alone. With hepatitis E, what they love about this one is, number one, it's fecal oral, just like A. However, we notice there is about a 20% mortality rate in pregnant females. So if they ask you about E, typically that's what they're going to ask you about. Now, as far as the other manifestations, very important, hepatitis A does not go to a chronic state. It doesn't go to chronic hepatitis or cirrhosis or hepatocellular carcinoma, okay? Typically, again, presents acutely, and the symptoms kind of go away after a few weeks. Very important, the laboratory diagnosis is going to be our IgM, anti-HAV, so remember that for the exam. Hepatitis B, of course, does go to chronic. Very important, goes to cirrhosis, chronic active hepatitis, and hepatocellular carcinoma. The serology, though, is very important for hepatitis B, so we'll go into that in detail in just a second, okay? C again goes to chronic. In fact, C goes to chronic more than B. And in fact, nowadays, when I get a biopsy for hepatitis from the liver, more likely they're going to ask me about C versus B. D can go to chronic. Why? Because it's going to be associated with B, so be aware of that. Okay. And again, E, the key is it's acute, but the problem is associated with mortality rates in pregnant females. Here's a chart of our hepatitis B markers. The ones I think you should be aware are of our number one, hepatitis surface antigen. If that's positive, that means active disease. And patients typically will be symptomatic, so I'll be aware of that. If the surface antibody is positive, very important, that means it provides immunity to hepatitis B and it signifies previous exposure to the virus, okay? However, if the hepatitis C antibody is positive, okay, very important to associate with the window period. They like that. What does that mean? Window period means that you have a disease and you're not showing the signs or symptoms, but you still can transmit the disease to somebody else. But the problem is the major serological test is negative. So during the window period, the hepatitis B surface antigen has gone up and already gone down. So it typically will be negative. So during the window period, you need to do the antibody to the hepatitis B C antigen to make a diagnosis for your hepatitis B infection. I would also note that the hepatitis E antigen is an important indicator for you to be able to transmit the disease. So very important to associate with infectivity. That's the other thing that they'll ask you about on the exam. Okay, so be aware of those serological tests. Now for hepatitis A serology, for our acute or recent infection, of course, our anti-HAV IgM. Remember, IgM is a primary antibody, so that's all you remember. For prior infection or immunization, look for IgG, which is your secondary antibody. Here's our biopsy of acute viral hepatitis B infection. One showing you our apoptotic body or councilman body. Again, it represents a dead cell. Remember, apoptosis means single cell death, okay? Surrounded by chronic inflammatory cells, mainly lymphocytes, okay? You're also seeing some balloon degeneration of cells associated with the injury to the hepatocytes secondary to the hepatitis B infection. Here's a biopsy of viral hepatitis C. Now here you're seeing a portal tract, okay, so the actual portal tract is in here, and it's being surrounded by chronic inflammatory cells. So a term we use is portal triaditis, and it's a typical picture for our mild or persistent chronic hepatitis. So we're saying that the inflammatory cells are within the so-called limiting plate of the hepatocytes. The limiting plate is the first row of hepatocytes that are around the portal tract.